Hi, my name is Liz, and I'm with Hope and Growth and Hope and Healing Therapy. I wanted to spend a little time today talking about the different types of therapists and the different types of counselors that you could work with when you are on your wellness journey. For a little context, I am a licensed marriage and family therapist as well as a coach, and I have been doing this for about 10 years. So, today's topic is talking about the different types of therapists. So many times when we are looking for a therapist or a coach, we're a little bit confused on what the different resources are and how we could best take advantage of them. So, I wanted to give a little bit of time to give us some understanding of what each of the different types of coaches and therapists are and how they could be of service. It's really important to understand the difference between each of these different types of specialists because we want to be able to work with someone who is going to be able to best work with what our needs are today. So, with that, let's go into it. The first one, many of you heard, and quite honestly, it's most often the term that we hear, is a psychologist. What is a psychologist? Typically, a psychologist is someone who has gone through both undergraduate, master's, and typically a PhD or a PsyD. They do have licensing requirements in each of the states that they practice in, and they are usually going to be having some specializations, clinical counseling, working with schools, specifically counseling arenas, etc. A lot of those skills are going to be what they've obtained during their education and degree. They are going to have a huge expertise in psychological testing and assessment, and they are going to focus a lot of their work on evidence based practice. What that means is they're going to find what has been tried and true, and they're going to make sure that they are utilizing that in session with you. One of the perks about a psychologist is they are going to be able to diagnose and treat mental disorders. Again, they have been looking and seeing a lot of this evidence based practices, so they are going to have an expertise on understanding what those disorders could be. Some common techniques psychologists use is cognitive behavioral therapy, which is also known as CBT, dialectical behavioral therapy, which is known as DBT, psychoanalysis, things like that. When you want to use a psychologist is going to be when you need testing, assessment, or if you're dealing with complex mental health issues that are going to require specialized treatment. Also, if you're looking for evidence based therapeutic assessments, psychologists are going to be the ones that you look to. The second one I wanted to talk about was mental health counselors. A mental health counselor usually has a specialty based on a specific subset of what we are working towards: addiction, trauma, grief. There's going to be something that they have spent a lot of their energy and their time learning to specialize in. Typically, a mental health counselor has gotten a master's degree, and they do have licensing certification requirements in each of the states that they practice in: an LPC, a LMHC. Making sure that you understand what their credential is going to be key. Some characteristics of a mental health counselor is they are going to be focused on practical problem solving and coping strategies. How do we get to handle what we are dealing with when it came to the specialty that they're working with? They are going to have an emphasis on building a relationship with you. So, what that means is they are going to be working on building that trust, building that bond, because the reality is when they're working on some of these specialties, especially substance, especially trauma, you're going to want to make sure that you are trusting the person that you're working with. And they have a lot of fantastic skills when it comes to crisis intervention and short term therapy. Some common techniques that mental health counselors use is person centered therapy, solution focused therapy, and cognitive behavioral techniques, similar to what you saw with psychologists. When do you want to use a mental health counselor? When you are dealing with stress, relationship issues, life transitions, if you are seeking short term therapy, or if you need support for specific issues like addiction or trauma that they are specializing in. The next one, social workers. A social worker also is going to be learning the general methods of handling treatment, but they are also going to be looking for specialization: clinical social work, community social work, etc. They also will typically have a master's degree. They are also going to be governed by licensing boards in each of the states that they practice in. One of the key characteristics to social workers is that they have a bigger approach to client care because they consider both environmental and social factors. They are going to have a strong advocacy for social justice, and they are going to have a lot of skill and experience in connecting one of their clients to community resources. A lot of techniques that they use, they're going to use strength based therapy, they're going to be very big on advocacy, they're going to be very big on resource coordination, and they are going to focus their attention on making sure that their clients have the resources that they need. When do you want to use a social worker? That would be when you are looking to get assistance with social services or community resources. If you are dealing with social or environmental factors that are impacting your mental health, and when you're looking for a holistic approach to therapy, big picture, not just focusing on one specific topic. How that differs so far from what we've learned, psychologists, again, very clear on assessment and testing, working with specific disorders. When we talk about mental health counselors, they're a little bit broader, but they are again going to be looking to build that relationship because they are also going to be working on those specialties. Social workers are going to be making sure that they have the resources that they can make available to you. Next one, marriage and family therapists. A marriage and family therapist, that's what my license is in, is a group that has a specialization when it comes to connection. Couples therapy, family therapy, friendship therapy, being able to work with multiple peoples and being able to figure out how to get them connecting. For training and education, marriage and family therapists are also required to have at least a master's in marriage and family therapy, and you will typically see their degree being shown as LMFT. They are also at the requirements of what the states have. So, again, each of the states are going to have specific requirements on how to get them licensed in their jurisdictions. A lot of characteristics that marriage and family therapists focus on is going to be relationships and family dynamics. They're going to have some expertise when it comes to systemic therapy and understanding how systems work. And they are going to have really strong skills when it comes to conflict resolution and communication enhancement. Some techniques that you're going to actually see when working with marriage and family therapists, you're going to see systems theory, you're going to see structural family therapy, you're going to see solution focused therapy, and you'll probably see emotionally focused therapy. When do you want to use a marriage and family therapist? When you are dealing with relationship issues or family conflicts, if you're seeking therapy for marriage or premarital counseling, or if there is something that is connected to the areas around you. Next one, coaches. Now we've talked about so many different levels of psychotherapists who provide some type of requirement that is held to a degree with states. Coaches typically are going to have a specialty as well when it comes to life, wellness, career, executive, so many different arenas that coaches focus on, just like different counselors and therapists do as well. When it comes to training and education, coaching is a little bit different in the sense that it is going to have certification programs and coaching schools, but there's not really a state required mandate of what they need to comply with in order to practice. Some characteristics when it comes to working with coaches, they're going to be focused on goal setting and personal development. They are going to have an emphasis on future oriented and action based strategies. And they're going to use accountability and motivation to kind of keep you going on track. Some common techniques that you're going to see when you're working with coaches: goal setting, action plans, accountability, motivational interviewing. The types of things that are going to actually get you excited to get to that next step. Another key when it comes to working with coaches, they stay very focused on the goal that you're working towards. When do you want to use a coach? When you are seeking to achieve personal or professional goals. If you have a very clear thing that you want to work towards, a coach is who you want to be talking to. If you're looking for guidance in specific areas like career or wellness, a coach is going to be someone who's fantastic at being able to offer those resources. And if you need accountability and a motivation for change, a coach is going to be great for something like that. The next one, psychiatrists. What is a psychiatrist? They are also medically trained. They are actually going to typically have a medical degree. They're going to have done a residency. They are going to usually be an MD or a DO. So they're going to typically be a doctor. Their specializations are going to be things like forensic psychiatry, child psychiatry, things like that. What their characteristics are, they're going to be very big on medical training. So, what that means is that they're going to be able to prescribe medication. They are going to have an expertise in diagnosing and treating severe mental health conditions. And they are going to actually work with the concept of integrating pharmacology into their therapeutic approaches. So, a lot of times, psychiatrists may actually diagnose, provide some medication, and work with a client in order to work towards something. Common techniques that psychiatrists use: medication management, psychotherapy, and integrated treatment plans. When do you want to use a psychiatrist? If you're dealing with a severe or a complex mental health disorder, psychiatrists are the ones that you want to reach out to. If you know medication management is needed, they're going to be your people as well. And if you know that there is a need for a combination of medical and therapeutic interventions, psychiatrists are going to be the only ones who can actually help with that. We talked about a lot of different specialists today, and I want to make sure that we just kind of recap and touch again on each of the ones that we talked about. Psychologists were the first. They typically are going to be masters or doctors, and they are actually going to be able to be great at assessing and testing. So if you're thinking that there's a medical diagnosis or there is some type of disorder that you need to work on, psychologists are going to be the ones that you need to talk to. The next one we talked about are mental health counselors. They are going to be fantastic at creating that bond between you. So when you are working on some type of thing that you know is going to take a lot of work and a lot of gut wrenching energy to get through, a mental health counselor is someone who's going to really be working on fixing that therapeutic relationship between you and them. If you're working with a social worker, that you're going to be looking for someone who is advocating for you, who's going to be looking for social justice, and who's going to be offering some really great opportunities in your community, as well as being able to work with the challenges that you're facing today. Marriage and family therapists, they are going to be the ones when you're working on communication, conflict resolution, working on something in between two or more people, and being able to understand something as it works in a system. Coaches, fantastic for goal setting. I know what I want to get to. I know I want to accomplish it. Someone who's going to hold me accountable as well as help me get to that next step. And then finally, psychiatrists, someone who is going to be able to balance both medication management as well as psychotherapy, as well as help with complex mental health disorders. All of them have really high value in our mental wellness journey. Understanding what I need today is going to be able to help me understand who could actually be a great resource for me. If you are looking for mental health, it's important to know what your resources are and know who you could lean on. Make sure you are looking at different opportunities to find those qualified therapists. Talk to your doctor, see if they can refer someone. Talk to friends, see if they've had success with anyone. And quite honestly, check online. There are so many therapy directories right now. And now that you understand the difference between each of the specialists, you can start to filter through what you are looking for and who could be of service to you. I hope this information was useful. I think that there's a lot of value in understanding what I'm looking for and understanding what each type of specialist can do to assist me on my journey. If I know what I am searching for or what I need help with, understanding what each specialist is going to be able to provide me is going to be key. The reality is, it's also going to be super valuable to understand where I am on my mental wellness journey and being able to understand what type of specialist can actually help me with that. I hope this was all useful. I look forward to continuing to share information that will help you grow and help you evolve on your wellness journey. Until then, have a great day.